So I would say that's the biggest problem, is that we have this profound failure of imagination, and that gets beaten into us either by working in situations of great privation, or we actually extend that notion of privation to others but not ourselves. So we can easily imagine dropping, I just dropped my daughter off at a very fine university not too far from here. But we somehow, in education among the poor, we don't think of tertiary education, we think of primary education. And I was just reading something Jim wrote, thinking about tuberculosis. The idea of selective primary health care, as Bill will remember, as laid out by the way, colleagues of ours from Harvard in the 80s, didn't even include any kind of treatment for tuberculosis, whether susceptible or resistance. And the first time you heard that, you'd say, really? That's how socialization for scarcity operates? It keeps on knocking interventions off the list. You mentioned leukemia in children. We just talked about AIDS. We've talked about hard to treat or expensive to treat tuberculosis. The list goes on. And moving back, it included getting vaccination rates above 20% to 80%. So the lesson about the big challenge, I think, is really about failure of imagination and about being so socialized for scarcity with no excuse, because we don't live in scarcity, but really on behalf of others, that it damages our approach to these pressing problems. And that's why when Bill came up with those three words, it sounded like music to us, if I may. Global health equity.